This is what prepared looks like for the NHS. Protective suits, results exchanged through glass.
I couldn't even see what her face looked like.
Craig Dillon spent 12 hours in quarantine at St Thomas's Hospital, the subject of multiple blood tests and swabs. He became ill while flying back from Thailand via a connecting flight through China.
There was the glass because we were like sealed in and had like the intercom that they were talking through. But of course, like they're all in these like masks, so they can't really. It's hard to. I could hardly really understand what they were saying because they're like sealed in these suits. So yeah, they were trying to explain, and they would like make notes on the paper and then sellotape them to the glass so the team outside could like copy the notes down.
While airport health checks in China picked up that Craig had a high temperature, at Heathrow he was waved straight through.
I landed at Heathrow and met all of my friends and went into work and went to like Starbucks and stuff like that. You know, there should have been something more at Heathrow.
In Scotland and Northern Ireland, a number of people are being tested for the coronavirus as a precaution. This after travelling from the Chinese city of Wuhan. At least 2 of those tested in Scotland were diagnosed with influenza. None have so far tested positive for the coronavirus. Before news emerged of suspected cases, Scotland's First Minister Nicola Sturgeon addressed the developing situation.
Well, I can assure the Chamber that, together with Health Protection Scotland, we are very closely monitoring what is a rapidly evolving situation. I should say that the risk to the public here in Scotland and indeed the UK is currently classified as low, but obviously that is kept under review.
In the Commons, the UK Health Secretary Matt Hancock set out similarly to reassure.
While there is an increased likelihood that cases may arise in this country, we are well prepared and well equipped to deal with them.
Over the last 2 weeks, Public Health England has been in touch with German researchers to develop a diagnostic test to identify the new strain of disease. And as a precaution, the NHS is preparing for the worst, with clinicians being advised on detection and infection control. But public health expert Professor John Ashton isn't convinced we're as prepared as we've been in the past.
Something that I'm worried about now are the weak connections often between the public health service in local government as it is and the clinical services in the NHS, which have been weakened since 2013 following that reorganisation.
In Newcastle's Chinatown, for those who have relatives in Wuhan, it is a worrying time.
Although we are going to celebrate the Chinese New Year this coming Sunday, or the people got in the mood to celebrate, but we hope everything will be all right over there.
Amidst preparations to celebrate the Lunar New Year, it's impossible to escape dark headlines of a growing crisis, as around the world, efforts continue urgently to limit its spread.